The Mental Health Status of Black America National Forum took place on July 28, 2011 in Washington, D.C. The forum was hosted by the Black Psychiatrists of America. Pictured here you see Dr. Patricia Newton, the Black Psychiatrists of America president. In a statement released by the Black Psychiatrists of America regarding the forum, it was said that the forum is slated to become an annual event and bring together a host of disciplines, organizations, and experts in the field of mental health from across the nation to seek solutions as well as make recommendations targeted towards key decision makers with respect to mental health policies and issues. The continuing challenges of violence, trauma, addictive behaviors, stress and anxiety disorders, and other problems in the midst of a severe economic crisis with lack of funding for critical services and programs, tied to a dwindling culturally competent healthcare workforce, signal that the mental well-being of African Americans, as well as all of American citizens, is in a full crisis. BlackMentalHealthNet.com went to Washington, D.C. to report on the event. In this slideshow, you will see many of the speakers and hear highlights from the lectures that were given. Pictured here is one of the event's honorary co-chair people, Delegate Shirley Nathan Pulliam of the Maryland House of Delegates. Delegate Pulliam has a background in nursing and experience working in inner-city Baltimore. This gave her a keen awareness of the suffering of the people of Baltimore and the toll of mental illness. Delegate Pulliam spoke of how the perspective gained in her community work and service led to her lawmaking and advocacy efforts as a delegate in the Maryland House. She spoke of our need to continue to work in removing stigma about Black mental health. The event's other honorary chairperson was Congressman Elijah Cummings of the 7th District in the U.S. House of Representatives. Congressman Cummings expressed an appreciation for the need of mental health care services and for mental health care parity. During his presentation, he said, quote, "I live in the inner city of Baltimore and have never left. I see so many people going through life. They're in a ball of confusion. They know that there's something wrong. Many of them feel as if they're on a merry-go-round and can't get off. Some of them are in so much pain, they don't even know they're in pain." Unquote. Congressman Cummings went on to describe his dealings with constituents who are struggling with the high rates of incarceration and trauma in the Black communities and the effects of incarceration and trauma on Black families. Toward the end of his speech, Congressman Cummings took time to thank the mental health care providers in the audience and to encourage them to continue in their work. With regards to the Affordable Care Act, the recently passed health care legislation, Congressman Cummings said, quote, "It's not enough to make progress. You've got to protect your progress." Unquote. The next speaker was U.S. Congresswoman Representative Donna Christensen, who was also a physician. She reviewed some of the provisions in the Affordable Care Act with a focus on the inclusion of provisions for health promotion and prevention and addressing health disparities. In regards to her work on the Affordable Care Act, she said that she worked from the principle that health care is a right. The next speaker was Professor Hunter Adams from the Royal Circle Foundation and Lifeways Science Institute. Professor Adams spoke of media as the, quote, "elephant in the room," unquote, that is missing from discussions about mental health and missing from discussion in legislation. He spoke of the need to consider the health of developing children and their families and the impact of media, since we as a society are, quote, "immersed," unquote, in it. He went on to describe the process of framing, which he defined as a process of selective control over media that shapes public communication. He spoke of how media content can be packaged in a way that promotes certain interpretations and rules out others. He went on to speak of how in mental health narratives depicted in film, TV, and videos, Black people with mental health issues are rarely depicted, and how when they are depicted, their behavior is usually seen as social pathology and is not given a proper historical or mental health context. Next up at the podium was Dr. Anel Prim, the Deputy Director of the American Psychiatric Association and the Director of the American Psychiatric Association's Office of Minority and National Affairs. Dr. Prim shared some striking statistics about the state of mental health care services for African Americans. She said that only 1 in 3 African Americans who need mental health care receive it. Dr. Prim told the audience how suicide is the 3rd leading cause of death for African Americans between the ages of 15 to 24, and that males aged 20 to 24 have the highest rates. She also described the phenomenon of suicide by cop, in which people may put themselves in a situation where they're very likely to be harmed or shot at by police. The next speaker was Dr. Wesley Clark, noted author and director of the National Center for Substance Abuse Treatment. Dr. Clark spoke of the need to address social context when considering mental health issues and mental health care. He said, quote, "Treating co-occurring disorders without addressing the social context is insufficient. It just won't work," unquote. He went on to tell the crowd how African Americans comprise 52% of the uninsured, and said that even among employed, lack of insurance is more common among people of color. The next speaker was Dr. Max T. Reglan. He described the harmful effects of a series of intergenerational traumas on the Black American psyche. These traumas include 246 years of forced enslavement, 17 years of Black Code laws, 89 years of Jim Crow, 46 years of integration, and 398 years of dehumanization. He spoke of the current incarceration crisis and quoted the statistic that in 2011, African Americans represent 46% of the male and 32% of the female inmate population nationwide. Joe Benson, the president of the National Association of Black Social Workers, was the next speaker. He spoke about the incarceration and criminalization of Black youth. He described statistics that illustrated the disparity between incarceration between races. He said that if a little boy was born in 2001, he would have a 1 in 3 chance of going to prison if he were Black, and a 1 in 17 chance of going to prison if he were white. If a girl was born in 2001, she would have a 1 in 17 chance of going to prison if she were Black, and a 1 in 111 chance of going to prison if she were white. He went on to describe how more white children are arrested but not detained. He said, quote, "In this society, everybody knows it. Basically what happens is the rich get richer and the poor get prison. Statistically, our children use less drugs and alcohol than any other group of people, but worry about it more. Adults believe the number one problem for our children is that they might go to jail, and that's absolutely true," unquote. He spoke of the need for recognition of racism and institutionalized racism as factors in the criminal justice system. And he also informed the crowd that the Office of Juvenile Justice and Delinquency Prevention did not have a current head. In the absence of leadership, money and funds were being rerouted from that office and used for other purposes. So even though there is a national office in place that is supposed to be addressing the issues of juvenile delinquency and the incarceration of youth, little is being done. The next speaker was Senior Judge Arthur Burnett Sr., the National Executive Director of the National African American Drug Policy Coalition. Judge Barnett spoke of the depictions of Black children and the Black community in the media and the need for a new conversation. He said, quote, "The media paints a picture of worthlessness and violence and deviation. We seldom hear about Black achievement. We need to begin to change the conversation. Let America know that there are Black children aspiring," unquote. In regards to mental health care, he spoke of how 2/3 of people who need treatment are not getting the appropriate help. He spoke of how this was in part due to the Tuskegee syndrome, or the distrust factor that many in the Black community have toward healthcare providers. The next speaker was Dr. Willie Davis, a member of the National Association of Black Social Workers. He described an integrated program approach, one in which mental health service needs and physical health service needs would be met in an integrated system of care. He spoke of loan repayment for mental health and medical professionals, recruitment into those fields, and training in addiction and primary care as necessary steps that needed to be taken in order for the integrated program approach to work. The next speaker was Dr. Faye Gary, the Medical Mutual of Ohio Kent W. Clapp Endowed Chair and Professor of Nursing at Case Western Reserve University and the Associate Dean for Minority Affairs and Health Disparities. Dr. Gary drew upon her clinical experience as a mental health nurse to provide poignant examples of the need for culturally competent care in accurate diagnoses and treatment, and in forming partnerships and effective therapeutic alliances with patients and their families. She encouraged greater collaboration between mental health care providers and historically Black colleges and universities, as well as greater collaboration with churches. The final speaker was Dr. Alpha Stewart, a former president of the Black Psychiatrists of America. She spoke about the funding of mental health care services and some of the changes that will be taking place under the Affordable Care Act. She described accountable care organizations and the need for Black mental health providers and medical providers to learn more about this model, which is going to be promoted under the Affordable Care Act. She said, quote, "This is not just a funding issue, but a conceptual issue of how services are designed," unquote. She reminded people of the vulnerability of the Black community during times of economic downturn and political strife. She encouraged people to be active in becoming educated about accountable care organizations, or ACOs, and the other changes that will be enacted as part of the Affordable Care Act, and emphasized the need for members of the Black community to lend their voice to local and national political discussions. This concludes our report on the mental health status of Black America National Forum. If anything you heard has inspired you to be in contact with your lawmakers, you can visit www.usa.gov to find out who your state and national representatives are, and how to contact them. This is Dr. Sarah Vinson for BlackMentalHealthNet.com.